Hi everyone, this is a easy way to learn medicine. We are moving to part 2, the remaining parts of the bones of the. First we are going to see the temporal bone. The temporal bone, you can see this one. This is a temporal bone. It's a squamous part of a temporal bone. This temporal bone, which articulate with the parietal bone by the squamous suture. You can see it's labeled out. And the temporal bone, which has a external aquatic meatus, and this one is styloid process, and this one is the mastoid process. This external aquatic meatus is the ear, and the temporal bone, which has a zygomatic process, it can called as a zygomatic arc. And here the depression, this is the temporal notch or mandibular notch, the mandibular which fixes there. This temporal bone, which has two important foramen. Here this one, this small one, here you can see the styloid process, and this one is the stylomastoid foramen, and one more one is the carotid canal or carotid foramen and stylomastoid foramen. In the temporal bone, this is squamous part of a temporal bone which has zygomatic process or temporal. This fully is called temporal arc, and you can see external aquatic meatus, this is external ear, and styloid process, this one styloid process, and this one is a mastoid process, and you can see the fossa. This one is called temporal fossa, which the mandibular condyle which fixes to the temporal bone. It's called temporal notch or temporal fossa, the depression. And the temporal bone is articulated with the parietal bone by the squamous suture, and the temporal bone is articulated with the occipital bone by the occipito-mastoid suture. You can see this one is internal aquatic meatus, and the important one is the groove for sinuses. This is a venous sinuses which continues into the transverse sinuses, and this is called the petrous part. The temporal bone forms the bulk of middle cranial fossa. Here the middle cranial fossa is situated. This is a sphenoid bone. The sphenoid bone, this is the important one. Every teacher will ask you what are the foramens which is present in the sphenoid bone? You can see foramen rotundum, foramen ovale, foramen spinosum, optic canal or optic foramen, and one more foramen which is a foramen lacerum. I will show you in the next picture, or some other picture I will remind you the foramen lacerum. And near the optic canal you can see the optic groove, and this depression is a tella turcica, which is called hypophyseal fossa. The hypophyseal fossa, the depression, and which has it is sphenoid bone which has two wings, the lesser wing and the greater wing, and it has clinicoid process and pterygoid process. This one is a pterygoid process, and this one is a clinoid process. And you have to remember the sella turcica, the depression which is for hypophyseal fossa, and this foramens: optic foramen, foramen rotundum, foramen ovale, foramen spinosum, and foramen lacerum. The ETHMOID bone, which is anterior to the sphenoid bone. Here you can see the crista galli. It's like a sharp edge or sharp lateral one, which is a crista galli, which has olfactory foramen. It's an important one. This side of the ETHMOID bone is called the lateral moss side. So lateral moss, and the perpendicular plate which form a nasal septum in the nasal cavity. This perpendicular plate which form nasal septum in the nasal cavity, and you have to remember the olfactory foramen in the cerebriform plate. And also it has orbital plate, ethmoidal. Here you can see orbital plate, the ethmoidal air cells, and which has two conchae, middle nasal conchae and the inferior nasal conchae, which are articulated with the perpendicular plate of nasal cavity. This nasal conchae, middle nasal conchae and inferior nasal conchae. In the ETHMOID bone, you can see here the cerebriform plate, which makes the olfactory pulp and the olfactory fibers. I told you olfactory foramen in the cerebriform plate. Here you can see the olfactory foramen. To nasal bone, you can see nasal bone. Behind this will have only cartilage, not a bone. Only upper part will have a bone, nasal bone. To VOMER bone, you can see VOMER bone, which is a inferior part of a nasal septum which articulate with perpendicular plate of nasal septum, and also it articulate with the septal cartilage, nasal bone, and this is septal cartilage. I told you two inferior nasal concha. You can see here middle nasal concha and inferior nasal concha. Okay, you can see here middle nasal concha. We have two nasal conchas. These are small bones which are articulated with the perpendicular plate of a nasal septum in the nasal cavity, and we have two lacrimal bone. This lacrimal bone, here you can see this lacrimal bone which form part of a medial wall of arbit. Here you can see lacrimal fossa and lacrimal foramen. This is way to the eye and to the nose. Zygomatic bone. Here the zygomatic bone. This one is a zygomatic. This zygomatic process. This one. Now what I am showing is a zygomatic process. It's articulated with the zygomatic bone. And this is a zygomatic process which fully called zygomatic arc. Zygomatic bone, this full called as zygomatic arc and zygomatic process. Let's move to the temporal bone. Palatine bone. This one, palatine bone, which is a horizontal plate. This is a horizontal position. This is a horizontal plate which is a posterior portion of a hard palatine. Hard palatine and floor of a nasal cavity, which make floor of a nasal cavity and posterior portion of hard palatine. This is a perpendicular position and the horizontal position. You can see here the palatine bone. This one, which make posterior portion of horizontal plate and floor of a nasal cavity. And maxilla. Maxilla, which have a infraorbital foramen and in the medial view you can find maxillary sinus. Here this one is alveolar process, and the teeth which are inserted into the space is called alveolar socket. The three things you have to know: infraorbital foramen and the maxillary sinus, and also this hole is called incisive fossa or incisive foramen. This little hole is called incisive fossa or incisive foramen. We have to know infraorbital foramen, maxillary sinus and incisive foramen. The maxilla, which make a palatine process, it articulate with the palatine bone, which make hard palatine. The palatine bone, the horizontal plate of palatine bone, which form posterior portion of hard palatine, which make palatine process. And Finally, mandible is a movable. Maxilla is not movable. We can move only mandible. This mandible is attached to the maxilla. You can find the mandibular fossa. In the temporal bone, you can find the depression to attach the mandibular bone to the temporal bone. It's called mandibular fossa. And you can observe notch, mandibular notch, and you can find mandibular foramen. And the mandibular fossa, the joint is called as temporomandibular joint. The mandible is getting attached to the temporal bone. The joint is called temporomandibular joint, and the other end is called coronoid process. Inside the mandible, the posterior view of the mandible, you can observe mandibular foramen, and the external view you can find mental foramen, the two foramens which present in the mandible, mental foramen and the mandibular foramen, the joint temporomandibular joint. And you have to tell body of the mandible, mandibular angle, the ramus of the mandible, coracoid process, temporomandibular joint, and the teeth which fixed into the space is called alveolar socket and the alveolar margin. Okay, thanks for watching. We'll continue to part 3, other bones. Please subscribe, share and comment. Thanks for watching.